Welcome to the Evolving Performance Podcast. The goal of this podcast is to share practical insights to maximize sport performance, durability, training adaptation, and career longevity. I'm your host, Kevin Neild. Today I'm excited to welcome Andrew Hauser to the podcast. Andrew is the owner of Continuum High Performance, a training, rehab, and consulting business located in Scottsdale, Arizona. Previously, Andrew worked as the Director of Performance Rehab and Assistant Athletic Trainer for the Los Angeles Dodgers, the Director of Player Health and Performance for the Atlanta Braves, and the Medical Coordinator for the Arizona Diamondbacks. On a personal note, I first connected with Andrew at a course around 15 years ago. Since that time, Andrew continues to be an aggressive consumer of continuing education and is constantly looking for better ways to help athletes prepare and recover. These efforts have led him to exploring the impact of different breathing strategies on markers of conditioning, performance, and recovery that are largely underutilized by athletes. In this episode, we do a deep dive into performance-based breathing strategies that can have a significant impact on an athlete's performance and recovery, but as I just mentioned, are not widely adopted by athletes currently. As part of this discussion, we'll touch on the science of breathing and how the relationship between carbon dioxide and oxygen can impact performance, specific breathing strategies to immediately impact short-term performance, longer-term adaptations to respiratory training, programming recommendations on how different breathing methods align with more traditional training practices, and where athletes should start with respiratory training and objective measures to monitor progress. Before we dive in, I just wanted to take a quick moment to thank our first sponsor on the show, Metabolic Elite. Metabolic Elite is a supplement and performance education company founded by James Laval, who is an internationally recognized clinical pharmacist and board-certified clinical nutritionist. Their entire line is designed to specifically support the health, performance, and recovery of high performers. Each product is formulated using research-supported ingredients and dosages using the highest quality ingredients, so you can be confident that every product you take will deliver the maximal benefit and effect. I've personally been taking Metabolic Elite supplements for the last several months, and one of the cool things about the line is that many of the products are made using a liposomal tablet delivery system, which is essentially just a chewable tablet. This LPT technology significantly improves the bioavailability of the supplement, or how much of the product is actually available for your body to use, but the chewable tablets are also easier to take for people that don't like swallowing pills. On a personal note, the two Synapsin products have been an absolute game changer for me. With a work and travel schedule that frequently requires both late nights and early mornings, I've never taken anything that's made me feel as mentally sharp as Synapsin. There's a lot of great information about Synapsin and the other products, the LPT technology, and other important tips to help you optimize your performance on the website. So go check out metabolicelite.co, that's metabolicelite.co, and you can save 15% off all products using the code NEILD15, that's NEELD 15 to save 15%. Now please welcome to the show, Andrew Hauser. Andrew, really excited to have you on. Thanks for doing this.
Yeah, no, thanks for having me, man. I feel like I need to talk semi-Canadian. It's not even Canadian. It's like there's a hockey dialect. Everybody sounds Canadian, but they're not.
Yeah, I've been accused a lot of having a Canadian accent, having grown up in southeastern Pennsylvania. It's a little off base, but I guess you pick things up as you go.
That's right.
You know, I want to do a deep dive on breathing and respiratory training and the impact that can have on performance, but just really to lay the foundation for that conversation, let's start very high level. And can you take us through the physiology of respiration? So, what happens when we breathe in and we breathe out?
I'm going to touch on some pieces because there's so many layers, I feel like, to it. It should be simple, but there's like some mechanical things that are happening. And I think that's a big one. And we'll touch on some like postural positioning and whatnot and what's happening, chest wall expansion or decompression, anatomical dead space. Like these are all important things. I actually recently got put onto an interesting researcher. There's two people I would urge everyone to go out and see before I really dive into this. There's a guy named Barry Ninham. He is an Australian researcher. He's an older fellow, did a lot on endothelial cells and essentially gas perfusion. And so there's a lot going on there that I'm going to be honest, I don't fully comprehend at this point. I mean, we're taking in so much nitrogen from air in general. And then that's also getting dispersed in the body. Most of what's lining our arteries is oxygen and nitrogen. And then most of what's lining our veins is then carbon dioxide. Carbon dioxide is the big one that I think people are starting to grasp onto it a little more, thanks to Patrick McKeown and probably James Nestor's book, Breathe. Both are great resources if nobody's looked into them. I think Nestor's book especially just it took a lot of information and did a good job simplifying it. They both discuss carbon dioxide a lot. And I think carbon dioxide for me has been the eye-opener for how I looked at things physiologically and just how truly important it is. And I know that's what Oxygen Advantage was built on. That's what Buteyko was built on. And to me, that's what high-level sport is built on. I was having this conversation this morning with a friend, and I'm starting to look at team sport. It's really just managing where you're at on the oxygen dissociation curve. And a big part of that is carbon dioxide. You have high levels of that, it's going to shift you to the right on that curve. And our CO2 levels are pretty tightly regulated systemically. That's what's happening. A guy goes out has a hard shift on the ice, or is on the court. Or you watch a Major League Baseball pitcher, as they're struggling or as there's an emotionally tense moment, their breathing is a little more erratic or a little more intense looking. So carbon dioxide is really yes, it's a byproduct, but it's also a foundational chemical within our body. I really started looking at that heavily a few years ago with a captometer. So I actually check that nasally. Right versus left nostril. I always tell guys it's just going to be the dumbest looking thing you do all day. I'm pretty confident of that because they have to stick this thing up their nose. I originally started doing it because I want to get a systemic idea. And I was comparing it to what I was finding in some of Buteyko's work with his control pause or with Patrick McKeown's bolt score. That's the same thing really, which they do correlate quite highly. But what they don't do is check that asymmetry. That to me is a fascinating thing in the football and the hockey world, especially because I was finding massive asymmetries with athletes that were concussed. And we'll say the measure that was clearly off, and it's usually 0.3% or greater. Sometimes I've seen up to 4% difference in a really traumatic head injury. But when you see those differences, the side again that's more abnormal generally relates to the side of impact as well. So there's a metabolic process that's taking place here. When there's that massive of an asymmetry, to me, you have a system that can't regulate oxygen throughout the body because oxygen is really it's a huge fuel source. There's creatine phosphate, I think, is another important chemical that's I think is even more important than I ever thought, but it follows the oxygen curve within tissue. And they've found that in research back in 1999, they found that. So again, it's a deep process, not to just work around your question, but taking air in through your nose and taking air in through your mouth are two dramatically different processes as well. So I think as we go and talk about more mechanical things, it'll explain the picture a little better rather than, hey, we take air in, it goes down our trachea, our tongue's doing this, it's doing that. Our diaphragm, is contracting. Our alveoli, that's what really allows the alveoli to take in air. And that's where the oxygen perfusion is really starting to happen. Because what I'm seeing is that it's actually got almost an ability to compartmentalize these different gases and then get oxygen into a red blood cell.
So you had mentioned this earlier on, and I just want to highlight it for the listener that may not be as familiar with what, a oxygen dissociation curve looks like. But can you just maybe go into a little bit more detail on the relationship between CO2 and oxygen dissociation and what oxygen dissociation means? And, essentially you had mentioned when CO2 goes up, how does that impact your body's ability to utilize oxygen?
Yeah, no, absolutely. The oxygen dissociation curve, think of it just being a regular, a XY axis. The curve's gradually going to go up. So if I move to the right of the curve, that is happening in higher CO2 environments. If I move more to the left of the curve, that's a lower CO2 environment. So when you're in lower CO2 environment, your system becomes more alkaline. Body temperature generally drops in those instances. So if you move to the right, it does the opposite. But I mean, you think if you do a hard workout, body temperature goes up, CO2 levels going up. So it's easier to conceptualize that way. Now you can drop off as you move to the right. You can drop off oxygen easier because you have more carbon dioxide. And this is, I think, where confusion can happen. It's because when it's tightly regulated by our bodies, our brains, our mitochondria, realistically, if we're not moving to the right, then we have to blow that CO2 off. Just because you can get more CO2 doesn't mean you need it. But if you do have that natural progression and shift to the right, so that's more of a chronic change that we're looking for. Everyone talks about CO2 tolerance. So your CO2 tolerance really should start to shift where you're at on that curve to the right side of that graph. So yeah, you'll drop off oxygen easier. You should start like systemically. Again, we're an allostatic system. So you should see your just resting body temperature go up if you're truly making changes. The cool thing, like during COVID, I was seeing these things. I mean, we were measuring everybody's temperature every day. So it was an easy testing ground. But it is where you're at on that curve. Like when you get back off a shift, let's say, and you're on the bench, you're shifted to the right, but you don't own the right. So it's like your body's naturally, you're breathing heavier, you're breathing more frequently. Your body's trying to shift you back to the middle of that curve, more or less. So there's different techniques where you can work to blow off carbon dioxide faster, because at that point, it's a performance advantage to get rid of it. You're not 7-8% CO2 systemically. At that moment, you are.
That example kind of serves as a nice segue to, I wanted to talk to you about some of the strategies that you can use and, the impact that can have both as far as the short-term responses and then more longer-term adaptations to some of the respiratory training strategies that you've used. And, I think typically we hear breathing strategies being used to, down-regulate sympathetic tone, and really, especially over the last 15 years or so, using some of these positional breathing strategies to help improve joint position or open up range of motion, both of which are really important. But you and I have had several conversations about what I think of as more performance-based breathing strategies. So you just gave the example of blowing off potentially excess CO2 after a shift. What are some short-term breathing strategies that somebody may use, during a competition to help facilitate a short-term shift either in their recovery or in their performance?
Yeah, there's, good question. There's two things I like to use specifically. It depends on the sport, depends on the situation, certainly. But for the athletes, like in your instance, you have a first-line guy, like he's going to have to get back on the ice pretty quick, especially if you had a power play coming up or something. And I learned this from a gentleman named Brian Kozak. I mean, he really mentored me in this space. It's a short, quick inhale through the nose, and then a powerful, like all your air out, exhale. Doing 3 to 5 of those. If I had a Moxy on somebody, a Moxy monitor, if it's just a muscle oxygen monitor for the people that haven't seen one, or I know Nox is the new device. If you have one on, you will see that shift happen within a couple of seconds. And so it just helps you get rid of more CO2 at a quicker pace. And it doesn't take too many. It's going to start to slow your breath back down. And that's the other skill I'll usually teach people for, use it with baseball players a lot, especially pre-at-bat, where they'll do it all nasally. They'll start to slow down their breath nasally. They'll do a 2-second inhale, 2-second exhale, and then they'll hold. I have them hold. I don't want to do a max hold, but at least 10 seconds. Ideal world, we're working at like anywhere up to a minute. But then they need to be able to go right back into and repeat that cycle. So long term, I use that with a lot of people before bed as well, especially individuals that have had anxiety issues, or if they snore, if they're going through an injury process. It's super easy. I start them 2 in, 2 out, 10-second hold. but you have to repeat that for 15 minutes if you're doing it at home, at least 15. And you will see some pretty crazy things as far as hemoglobin going up and as well as picking up more oxygen. So it looks like they're doing an active recovery work on a bike. Actually, if you had a Moxie monitor again on someone, you'll see CO2 levels substantially rise as well, which I think it's worth noting. Like athletes or general people that have, like if they have anxiety symptoms, I mean, they're under 5%. It's pretty much a lock in my experience. Usually they're in the low to mid 4s. Sometimes you'll see people in the 3% range, CO2 levels systemically. Most professional athletes live between about 5 and 5.5%. And to me, the higher you are, the better idea I have of how you can recover, because carbon dioxide is a vasodilator and a natural anti-inflammatory. So usually the higher are like the more, they usually have like robust aerobic systems, the individuals that can do that, where they've done some breath training.
So you had mentioned 2 seconds in, 2 seconds out, both through your nose, then holding your breath, starting with 10-second holds. And correct me if I'm wrong, I thought you mentioned with holds up to a minute.
Yeah, not very many people can do that, but
sure. And then repeating that for up to 15 minutes at a clip. And that would be a strategy to improve the body's CO2 tolerance.
So it's going to drive carbon dioxide up, and it's also going to slow their breath down. That's probably the most important thing. So that's why I use it with people in sport. They're obviously not going to do it for 15 minutes during a game, but it's going to slow their breathing down. As our carbon dioxide goes up, generally, if we can't control that, our respiration rate has to pick up. And most of us are overbreathers anyways, if we're breathing way more than we should be. Something I've seen experientially with a number of athletes actually in a variety of sports. So many guys wear Aura or Whoop now. It's nice because you can get this information. But I mean, respiration rate, we all know it picks up right before you get sick. But I've been seeing the same thing over the last few years right before a non-contact injury occurs as well. So our body knows it's in a state of stress. Now it's just starting to blow off the CO2 we do need. And so it's shifting you now. Talked about that curve. It's shifting you to the left side of that curve now. I've seen this a lot with injuries, with dehydration, with longer flights, autoimmune issues, where you put a Moxie monitor on somebody and it's wow, 90% oxygen, 80% oxygen, right away. But their hemoglobin level, or if you use a capnometer, their CO2 level will be super low. So it's they have a full gas tank, but they have a Fiat gas tank rather than a professional athlete. You need at least a F-150. Well, no, we'll pick a sportier car, but you need a big tank. You don't want a small one. That's what tends to happen, though, in athletes, especially as the season goes on or guys are getting injured, their tanks plummeting. Emotional issues, you see the same thing. It's you have all these monitoring options that are all telling pieces of the same story. And I think the breath for me is what connects all these pieces.
So I want to circle back to that 2 in, 2 out hold as a longer term training adaptation strategy in a second here. But from a short term standpoint, you had mentioned a guy steps off the mound, you may have him use that. I imagine as a short term calm down, a little bit of a reset, even mentally, it gives you an opportunity to step away, go through a routine to reset a little bit. So within that similar context, there are other strategies that have been recommended, whether it's, the physiological sigh that's gotten a lot of press recently, or, even just controlled, almost box breathing type strategies. I'm hoping that you can kind of highlight what maybe some of the similarities are in these approaches, and or why should somebody listening, if they're an athlete and, if they're a hockey player, they're coming off a hard shift, or, if they're a football player and, they're in a hurry up offense and they have minimal time and need to maximize their recovery in the short breaks that they have, what would be the most effective strategy in those situations?
The one thing they all have in common, and this is what I really appreciate about what Wim Hof has done, it brings attention to their breath. So box breathing, I know that there's been probably more research done on that technique than just about any technique out there, especially in the special operator space. But it's slowing their breath down at the end of the day. There's some interesting research on like physiological coordination in the breath. A lot of Buteko's work kind of goes back to that. A lot of like yogic practices, a lot of religious practices all end up falling within the same realm, which I found really fascinating. By no means am I making this a spiritual or yoga directed breath talk, because I think that also loses a lot of people, to be quite honest. But I do think like bringing focus to the breath is what they all do well, because it is a skill. Like, yeah, we all have the innate ability to do these things, not think about them. That's the cerebellum of our brain was really good at that. But like any skill, like we're all born and we can all run, we can all walk, but there are still skills you work on. So that's where I think, for me, the short inhale, quick exhale, just as an example, is the fastest route to like, hey, I need to get this out and I need to be back ready to go. You can do the same thing like right before a shift, because CO2 is going to go up as soon as you take off and do like a powerful movement. Like you hop over the boards and you go, CO2 is going to start driving up. So you're giving yourself almost a head start when you're doing that. Other techniques aren't really focused on that. I mean, box breathing will have a benefit, again, of slowing your breath. I think the nasal portion and finishing on the exhale does a better job of calming the nervous system than box breathing, in my experience, because that's really when you can get that full exhale, and it's not forced, but that's when like your intercostals relax. That's when your neck relaxes. Like that's when we're talking about now more biomechanical or mechanical things that are aiding in that autonomic recovery.
So that would be, instead of box breathing, which is in, hold, out, hold, in, hold, out, hold, you're describing in, out, hold.
Correct.
Be, you could call that triangle breathing. There's
Triangle,
a whole new market,
right.
Whole new market for it.
Hey, the Egyptians had something figured out.
So, maybe let's just quickly look at the other side of the spectrum. You have guys, I certainly at the professional level, but increasingly so at youth levels, even where, you're starting to see more professional sport like schedules at youth levels. Obviously, especially the high school years, the kids are wired to sleep in later and they're not afforded that opportunity. They still have to wake up early for school. So, if you have athletes that are feeling a little sluggish, energy is down, maybe mentally they don't feel as alert as they'd like to, and they have a practice or they're getting ready for a game, are there any strategies that you've used that in the short term can help, re-energize the system, for lack of a better phrase?
Well, I think one, I would cold plunge. The cold plunge one's interesting because it's definitely going to wake you up. It's a matter of not allowing yourself to hyperventilate when you do that, which is obviously a challenge. Sunlight is a whole other thing. I know this isn't going to become a light conversation. We've had a number of talks around red light.
We'll save that for the next podcast.
Yeah. The thing about sunlight, though, is it's going to drive up nitric oxide and it's going to drive up hemoglobin. And both things actually will have an effect on systemic CO2 levels for the better as well. So they're aiding into your breath already. So if you're going to do either, like I would start with that 2 in, 2 out hold. So that's just, again, that's kind of setting the base. And then when I'm talking about a performance piece at that point, that's when I start to use, I use a Breathe Way Better. Some people, if you still have access to a Spiro Tiger, great. They don't make them anymore, unfortunately. But I'll do something called speed breathing. And really it's in and out as fast as you can. So it's, there's different yogic practices like that too, that they'll do nasally, but that is the fastest. Some of Wim Hof's work actually does a good job with that, because it is going to be a fast, it's going to spike your nervous system. So once you've kind of laid the foundation, you got to ramp up the system.
So can you, obviously we don't have the breathing bags in front of us, but can you just quick example of, how would you speed breathe and how long would you do it? What's kind of like a set rep recommendation?
So I start with a smaller bag size just because I want to go in and out as fast as I can. And this is all through the mouth. Now, again, you can do this through the nose. I recommend just starting at like sets of 7 to 10 seconds. Almost go back to like Verkhoshansky. I'm sure you have a lot of strength coaches listening. Like Verkhoshansky's anti-glycolytic work, like it was 8 seconds long, and then it's a full recovery. So think about it similar to that, because it's going to be fast, and then you need a full recovery. And what it's doing is working on that fast tensioning and that fast relaxation. Relaxation is really what makes an elite athlete, especially a healthy one. So the ability of a fast relaxation. So when you can get the diaphragm to do that, you're having a massive systemic effect on the body. Yeah, so in and out, like let's say doing it with a 1.5, 2 liter bag. So it's not large. Breathe Away Betters come with like a 6 liter bag, 5 to 6 liters. Most people can't fill that very well, in my experience anyways. But the smaller it gets with speed breathing, the more challenging actually, because you have to relax it so quick.
And then, transitioning into more longer term strategies that you might integrate into the training process with the hope of, not just stimulating some short term change, but looking more over the course of several weeks to months. What are some of the more impactful respiratory training strategies you've used? And, as you're kind of describing some of those, what are the benefits, either that the athlete reports or, some of the measurables that you're taking to document that an athlete is actually making progress in the intended direction?
Yeah, so I do spirometric tests on every athlete that walks through the door. So we have a baseline, and that gives me a good idea. So like I'm looking at 4 things particularly, but 2 I'm looking at like, okay, like this is what we need to focus on as far as change goes. It's forced vital capacity, which in an untrained respiratory system is usually about 80% of your lung capacity. And then FEV1. So it's essentially how much air you can blow out in 1 second. As someone's coordination gets better or their ability to relax their diaphragm gets better, that typically gets quite a bit better. So both are good research between just general wellness around those numbers. You see some surprising numbers. I always tell guys, like, you look at forced vital capacity, like think of that, again, that's we'll say your max strength. The FEV1 is more, hey, that's how well do you coordinate things. And then there's something called peak expiratory flow. That's like your velocity. So what's your peak velocity that you can attain? So I try to break those down now into, like we're talking about programming. A lot of times I'll use those in part of like supersets with something that's feeding the same intent, really. So let's say I'm squatting. Okay, if I'm squatting, I'm either going to speed breathe realistically, depending on my intent, or I'm going to do more max strength volume work. I really like to use the volume work as well to work on asymmetries from more of a performance lens, like because you can do multi-directional things, you can rotate, you can go into different movement planes. But again, you're driving the ability to get in a different position and then maximally contract. So get more motor units firing. And
you had mentioned that forced expiratory volume going up as your diaphragm relaxation improves. And is that because there's more resting tension in your diaphragm, it doesn't have the capacity to dome as much, so there's not as much of an excursion to then push air out in that first second?
So it's interesting. Yeah, you're taking the tension out of other musculature, so you can actually get more doming. It'll actually dome even more, and that's one of the things. Like I'm big on feel when I'm teaching a lot of from a rehab perspective, but also from a breath perspective, because I think when you feel something, then you can recreate it. You're tag teaming what the brain can set. You're tag teaming your senses with a mechanical thing. But I always want to make sure they get enough air out to where they'll feel their lower abdomen contract. And that's in any of the breath work I do with them. Again, depending on what breath modality we're choosing, like that doesn't mean it's a very forceful breath, but when you feel that contraction, that's the pelvic diaphragm really pulling on that transverse abdominis. So you're getting doming of the diaphragm at that moment. because that pelvic diaphragm has to tension up so the thoracic diaphragm can dome over it. That creates kind of like that piston or that 360 degree, like Pavel Kolosh would talk about. But that's when that happens. Like, so early on, I'm going to start them I'll get them in very specific positions to start to understand at least the feeling before we can mix it into a lift, or I'll use it as part of their warm up. Some things I just want to use in their warm up long term anyways, because whatever picture we're trying to create or system that we're trying to influence for performance or to warm up for performance, we can create that picture with our breath. And I don't think I even said, so there's 4 main breathing strategies that I'm going to use with a breathing bag. And now there can be derivatives of all of these, but I'm going to do tidal volume work. So again, think just max strength. I'll use my arms in different ways. I'll seek different movement planes. Usually, like from a mobility perspective, you'll feel just nice after it.
Can you explain what that would look like? So, when you're saying tidal volume work, for somebody that's not familiar with any of this, like what are you actually doing to facilitate?
If I have a breathing bag, like I'm not letting my ribs necessarily rise up with it, but my arms, think almost like face pull, are coming up. And then as I blow out maximally, getting my forearms together. So I'm using my lats, I'm using a lot of fascial tension to expand and then contract and get all that air out. So you're essentially giving it just an extra push. I can do that one side at a time. I can do that rotational. I can do that on the ground. I can do that however I want. Do that with lower body movements. Again, number of different ways, but great way to warm up, but a great way to start feeling things. And it ends up being a little less technique specific. So it's an easy way just to start with the bag.
And then how long would you do, is that you would do 3 sets for 20 to 30 seconds or 30 to 60? What are kind of your general starting point recommendations there?
So with that, I keep volume down. I keep it, think almost like Prelepin's chart, like from a rep perspective. Like I'm probably going to keep it between 20 and 25 reps total to start with, where like, let's say 5 sets of 5. A lot of times I'll just say, hey, go off. Like you're going to feel your velocity drop. You can't get as much air out. It's fine. Set's over. So like that's where I start. So is that 4 sets of 5? Is that 5 sets of 5? Is that 10 sets of 2? It's going to differ depending on the athlete and how much time we have too. Speed breathing, I'm going to team that up with more high velocity work. That's going to be either more coordination work for me, or we've got some velocity to get, like whether that's sprint velocity, whether that's shooting, whether that's throwing. You just know their nervous system has to be primed a little more. Coordination breathing is actually where I start most athletes. It's more technique specific, but they need to feel the ability to relax. I always equate it to like we've all run like baselines in like basketball or on the ice. The same concept, like anything like stop and go. You don't stop and keep going. You've got to touch the line, touch the cone, you go. And that's starting to teach that relaxation. It needs to be slow enough where they can control it, but fast enough where it does push them as well. It doesn't take long for that. That I do more for time. I usually start people at 2 to 3 minutes at a time. Then pending the sport will depend on kind of how long I push that. Like major league pitchers, that's I build a lot of their off season. I'm trying to build them up 8 to 10 minutes of doing that because, hey, I can start to build physiological load when their arms aren't there yet. Ultimately, injuries occur under fatigue, unless it's like a gnarly contact injury. I don't know if you saw Mbappe get hit the other day and his nose break open in France's game. No amount of breathing is going to stop that. But like, again, these are when most injuries are occurring in every sport that you and I have worked in or with. That's when the majority of these injuries. And in my experience, again, you hit an inflection point. You can't out-condition certain things. And this can get to, again, more of a deep conditioning topic as well. The ability to control your breath and get it back to baseline quicker is only going to allow you to do more work. Or it's going to give you a step on the ice, a step on the court, a step on the field, more clarity of mind. because your body is not hyper panic mode because you feel like you need to breathe.
You brought up a couple interesting concepts. I mean, I think first, integrating some of these strategies into a warm-up not only allows the athlete to take advantage of some of the short-term benefits that we had mentioned, building it into a routine also allows the athlete to accumulate some volume of this work, over the course of weeks, months, and probably years. So, I think that that's probably a good strategy that people listening can start to play around with. And then the other idea of just periodizing the breathing. So, understanding what the theme is for that day from a training standpoint in particular, and then trying to link up the respiratory training strategies that best align with that, I think is something that obviously you and I have talked about that in the past before, but I haven't heard that idea from anywhere else. So I think that's pretty interesting. I think this idea, as people are hearing, there's probably some novel strategies. There's some assessment techniques that you're using that aren't as commonplace among the athlete spaces. I think some of these probably have a richer history in the clinical space, but I'm curious, how would an athlete know if their respiration is a primary limiting factor to their performance? So, if I'm an athlete listening to this and it's like, all right, I've been told I need to get, bigger, stronger, or faster, or better condition, you name it. Like, how would they be able to identify that this is something that should also be capturing their attention at a high level?
Yeah. Well, number one, honestly, very few athletes have trained it. And we train our systems all the time, but then we have this huge, impactful, system that we don't pay a lot of attention to. So to me, every athlete will see benefits. Now, to answer your question more head on, I think an easy way for athletes to find out if they're just looking at their own, let's say you go through a hard shift or do something hard on the court, time how long it takes for your breath to return to what's actually normal. Not still taking big breaths in, but just back to normal, relaxed breathing. In an ideal world, an elite athlete should be about 45 seconds. That's a first-line guy that's healthy in the NHL. In my experience, most professional athletes that have stayed relatively healthy are around 60 seconds. But if you can't do that over time, again, then it becomes even more of an issue. Let's say you go 2 shifts from the hockey world, you come back and now it's 2 minutes, it's a minute and a half, whatever, it's 3 minutes, even longer. You've got low-hanging fruit on the respiratory side. Now, I think some more that takes zero work, someone with a narrow face, I've got a more narrow face, you're going to be more prone to tongue ties, higher palates from a mechanical perspective. That puts you at more of a mechanical disadvantage where you need more respiratory work. Because when you have a high palate, your tongue will tension a lot. Your tongue is huge. If you snore, same thing. Most of these individuals do snore. But when you tension that tongue, that's pulling right on the trachea. And for those hunters out there that have ever gutted an animal, or if you've done an anatomy lab at all, the trachea is like a Chinese finger trap. When you start yanking on it, so whether that's tongue tension or whether that's more anatomical dead space, which you could probably argue these are two, it's feeding the same thing. You breathe more, you tension more the trachea more. Anyways, that'll yank on the diaphragm upwards. That'll extend you more. So now it's easier to get air in, but now it's harder to mechanically get air out. So that's going to start limiting things. For rotational athletes, that's going to start limiting thoracic rotation. Pretty important throwing athletes or in anything that needs to sprint or run. A lot of athletes, in my experience, have some acid reflux issues. They all take Tums or something before a game or something to try to combat that. There's a physiological reason that's happening. And I think we're seeing it more. This is a different conversation as well. But as people spend more time on their phones, their cervical spines start to straighten out more from a visual thing. I've seen that over and over just in imaging. So it's not just me throwing something random out there. As that straightens out more, it's going to have that same effect.
So, you had mentioned strategies to improve CO2 tolerance. You talked about the benefits of breathing coordination, about diaphragmatic relaxation. Is there a a differential diagnosis process that you'll go at to identify if, an athlete needs to really focus on one specific aspect of respiratory training, or, at least for most people, is it, it's almost like somebody that's new to a training program in general. It's like you can afford to do some sprint work, some strength work, some conditioning work, and they're going to make improvements in all of those areas just because their window for adaptation is so large across the board. What's your approach in that regard as far as respiratory training?
Everyone can benefit from that 2 in, 2 out hold, and that's straight from Buteko's work. Again, as that 10 seconds gets easier on the hold, we'll push it. You keep pushing it. Like, I prefer, most people are around 2 in, 2 out with a 20-second hold, to be honest. I mean, that's 3 breaths per minute by the time you're done.
And just because that's come up a couple times, are you in those 2 seconds, is it full inhale, air all the way out, exhale, or is it more middling so you're not completely full and not completely empty?
Yeah, think normal breath, but it's always veered onto the exhalation side of that continuum. But very normal breath. Nothing about it's forced, because when you have to repeat that much for that long, you can't hold for too long. It'll change as you're going. Like, you might start at 10 seconds. You might be at 14 seconds by the time you finish. But again, you have to be able to go right back into that same cycle constantly. So again, that's something that you don't need any equipment for. Now, if you're going to get a breathing bag, I would start with coordination breathing, because you can build up so much time and you're just building up efficiency. That's what true coordination is in every sport. Like, we always admire the athletes that make things look easy. That's physiological coordination. And we would see that in real time if we had certain devices on them. Again, that's what you're going for ultimately, is making it look pretty.
Cool. Well, I know there's a lot of other things that we wanted to talk about as far as preparing for flying in altitude, and some of the strategies before, during, and after those situations. But we'll have to save that for a follow-up episode too here.
Just recovery in general is another conversation, because it can there's breathing strategies, but then there's other strategies that, again, multiple roads lead to Rome. So I never want people to think like, hey, okay, I don't have a breathing bag. Well, hey, here's an option without a breathing bag. That's a breath. Here's an exercise way to do that. Here's passive modality of some sort that'll attain that. And they're just kind of all on varying levels, but they're all pushing the same intent.
No, that's a great point. So right now we have a light episode teed up for you in the future, and we have an altitude flying and recovery episode teed up for you. So do us a favor and clear out your schedule for the next month, and we'll do this again. But in the meantime, where can listeners find more information about you and your company and what you have going on?
Yeah, so my company is Continuum High Performance in Scottsdale, Arizona. Let's see, just look for me on, I don't even know what my Instagram handle is, but just look for me. I'll probably have to send you that. You can put it in the show notes. Email me at andrew@continuumhp.com. There's 2 U's in Continuum. I found a lot of people don't realize that. Email is a good starting point, or just DM me on Instagram. We'll figure it out.
At the handle that we don't know yet.
At the handle we don't know.
We'll have to find that in the show
notes. I'm good
notes,
about checking it. I'm not good about posting things on there. So
we'll get that squared away. But thanks again. Appreciate you doing this.
Yeah. Have a good one, man.